And that is why we...
Now let's get some more insight on Nigeria and indeed Africa's polio-free status as declared by the World Health Organization today. And joining us on the news at 10 tonight is the Minister of Health, Dr. Osage Eyanire. You're welcome to the news at 10.
Good evening.
Good evening to you, sir. Now, this is no doubt cheery news for all Nigerians. Can you walk us through the journey to this destination?
Well, it's been a very long journey, and we have reached a pivotal destination. As Nelson Mandela said, those kick polio out of Africa. We have reached that goal. So Nigeria is proud to be among the nations that are now fully polio-free. The last case was in 2016, August to be precise, 4 years ago. And since 3 years ago, since last year, since a year ago, since 2019, the process of verification has been going on and concluded now for the regional office of the WHO to declare Nigeria polio-free.
Now, being polio-free is no doubt fantastic news, but what are the chances of a resurgence?
Well, the chances of resurgence are chances that we can control if we build up our routine immunization, which we intend to do. We are now at about 70% coverage. We know that the remaining 30% is more difficult. So we are developing strategies to expand the coverage up to 90%. The difficult areas will be hard to reach areas and areas that you probably not find transport. So we have acquired motorcycles that will be able to carry vaccinators all the way to what we call the last mile. In addition, we're expanding the primary healthcare structure to provide services, of which routine immunization is the key. And if we have a platform of functional primary healthcare centers, routine immunization, well established, and the surveillance principles set up, we are carrying out very strict acute flaccid paralysis surveillance, then we should have control of the polio eradication and be able to maintain it.
And no doubt there's no better time than this than to ask you the next question. How optimistic are you about Nigeria surmounting COVID-19 the way we've defeated polio?
Well, COVID-19 is a different kettle of fish altogether. It is a virus that is very easily transmitted in a different way, and it has spread all over the world, as you will see, in a way that polio did not spread, in a way that, in fact, Ebola did not spread. So it's peculiar in itself, but we have had a lot of lessons that we learned from the polio experience and also from the Ebola experience, and it has helped us very much. Nigeria has a virus disease hospital in Irua, from where we have brought specialists who have been very helpful in setting up our strategy. And the Ministry of Health has already now created a national response action plan that will cover the next 3 years of responding to COVID-19. The response plan has to be very specific and very flexible because not everything is known about the COVID-19 virus. But every day we are learning more and more about it and responding with the knowledge we know, and also waiting for vaccines to be developed, perhaps within the next 1 year.
We hope that happens to be the case. Thank you so much for your time, for coming on the news at 10 tonight.